Frozen shoulder. The shoulder is a ball and socket joint surrounded by a loose bag called the capsule. In a frozen shoulder, the capsule becomes irritated. It becomes inflamed and painful to move. Moving the body around the arm. For this exercise, if you stand in front of a table or kitchen surface and rest your hands on the surface. Reach forwards, sliding your hands forwards as far as you're comfortable to go, and then returning to the start position. As you get more confident, try and slide your arms a bit further forwards. And as you get to the top, you can bend your knees and lean your body weight back to provide an overpressure and a stretch. Returning to standing, gently slide your hands backwards and repeat this exercise around 10 times. External rotation with a stick. For this one, if you hold any long item, a stick, umbrella, golf club, whatever you have around the house, hold it with your palms facing upwards and elbows bent at a right angle. Keep the elbow tucked in at the side. Use your good arm to push the stick and rotate the arm outwards as far as you can. Hold for a couple of seconds at the end of range and then move this back in. And repeating, just trying to push it a little bit further each time you're going and then coming back. External rotation with a weight. Lying on your back with a weight in your hand, keeping your elbow bent at a right angle. Hold your upper arm with the opposite hand close to your body and let the weight take the arm into external rotation, taking the hand down towards the floor, elbow tucked in at your side, and just hold at the end of range for 5 seconds and then bring it back in. And again, lowering down and go as far as you're happy to, just trying to increase that a little bit more each repetition and back in. And again, if you aim for around 10 repetitions with this. Weighted hand behind head exercise. For this one, if you lie at the foot of your bed so that you have room to move the weight behind your head, hold a weight in your hand, and with this one, if you bend the elbow, careful not to hit your head, and just take the arm back, aiming to go off the end of the bed and go into a stretch as far as you can, hold for 5 seconds and then come back up. And again, repeating down, just taking care to avoid your head and letting gravity take the weight off the end of the bed as far as you can and then coming back up. Weighted sleeper stretch. For this one, you need to lie on the bad shoulder with the arm out in front of you and the elbow bent. Hold the weight in your hand. Keep your shoulders on top of each other, so don't roll back. With this one, let the arm internally rotate, taking the hand down towards the bed and holding at the end of range there, again for around 5 seconds, and then coming back up. Trying to keep the elbow still and not moving up and down, but just internally rotating to achieve the movement. Letting gravity push the weight down, hold for 5 seconds, and then come back up. Exercises may be uncomfortable to do. You are in control of how far you push yourself. Start gently and gradually increase at an acceptable level to you. You should exercise your shoulder regularly. Aim to exercise around 2 to 3 times a day, around 5 to 10 minutes each session. So you may start with around 10 repetitions of each exercise, but you can do more or less as you need to. We hope you find these exercises helpful. If you do continue to struggle with your shoulder, please do contact your GP or physiotherapy department.